Why mostly elderly patients knee pain does not always mean replacement?
See, many times those who are beyond 50 years of age, 50 years, 55 years of age, what we call is elderly or middle age, beyond 45, 50 and plus. They will have knee pain at some point of time in their lives. And always the first episode of knee pain in an elderly or middle aged person is always not meaning he's drifting towards a knee replacement. So that concept that every aging person will need a knee replacement is not a fact. See, the knee pain will start at some point of time from one area of the joint, and after that episode of pain, sometimes patient may develop stiffness after activity, or towards the end of the day they feel little tired or achy in the knees. So these are the early signs of early arthritis, meaning that process of arthritis starts early in the life, but by the time you present with a symptoms like a pain or stiffness or a swelling, it is usually in the later part of the disease, when the body's own mechanism, which compensates healing and repairing. So when healing and repairing slows down, and the damaged part of the or attrition or the wear and tear part is not taken care of by the joint's own mechanism to restore the balance, at that point of time patient will start. The earliest thing what you see is the pain on the stairs, pain getting up the steps, going down the steps, sitting on the floor and getting up. These are the early symptoms, signs where you may think that early wear and tear is going on, usually followed by pain on standing, pain on walking. So this is how the gradually people will have some disturbances in running, jumping, steps, squatting and getting up from the chair, taking first few steps, and then they feel better. So these are the usual areas where the patellofemoral joint wear and tear is telling you that this area is getting affected. When the patient starts having pain on prolonged standing walking, it will still be indicative that it is still a mild to moderate change which is affecting, or symptoms are because of that. But when you have pain at every step, every standing motion, that means we are dealing with a more moderate to advanced kind of disease. And when you have a pain at rest, that means there is permanent cycle of inflammation, what we call is a chronic inflammation within the joint, in probability because of the osteoarthritic process. See, arthritis are various types, but in elderly or middle-aged patient without any antecedent history and a single joint or only two knee joints are getting symptomatic or affected, usually first thing which comes in mind is an early arthritis, which we usually confirm with clinical assessment and the alignment x-rays, and based on that we can justify the treatment protocol. But every patient who has a knee pain beyond 45, 50 years of age is not straightway a case for replacing the knee.